Today I will be focusing on the numbers from over the weekend as well as some of the trends we've been seeing. Over the weekend, Ontario reported 2 days of record high daily cases. On Saturday, 978 new cases. On Sunday, 1,042 new cases. Today, that number has gone down slightly. We're reporting an increase of 851 cases. Our 7-day average for new cases is 878, which is a 20% increase over the last week. 77% of our cases reported over the last few days are concentrated in the public health units that are in a modified stage 2, Toronto, Peel, Ottawa, and York. In terms of testing system-wide, yesterday there were 28,652 tests completed with a positivity rate of 3.8%. Our 7-day average for percent positivity is currently 3%, which is an increase from 2.6% a week ago. Most age groups continue to have positivity rates over 2%, although the rates continue to be highest for those in the age groups from 20 to 59 years of age. If we look at the weekly trends, there were 123 new outbreaks in the last week, which is an almost 8% increase over the prior week. Public health units continue to report ongoing outbreaks in 83 long-term care homes, 49 retirement homes, and 17 hospitals. We're also seeing a number of outbreaks related to sports teams. For example, Ottawa Public Health has reported over 50 cases linked to 7 sports and recreation outbreaks, including 6 in hockey and 1 in football. We also continue to see outbreaks in our schools, although I'm very pleased to report that there are currently no schools closed due to cases of COVID-19 in Ontario. Our health units have also reported clusters related to family gatherings, including from the Thanksgiving Day weekend. With that, I'll turn it over to Dr. Williams.
Yes, well, good afternoon. And as we've been saying, we've been looking at these record high numbers over the past weekend as we have been going up in steps up to this current level. We're down, of course, again today, down to 850, but that's one day. We want to see what the rest of the week brings as we deal with the numbers coming in over the weekend and to this early part of the coming week. As we said before, the Thanksgiving weekend impact is showing up during this past weekend and seeing what the numbers are. But at the same time, our modified level 2s for the areas that Dr. Yaffe had noted, Toronto, Ottawa, Peel, and York, have been implemented on the Thanksgiving weekend as well, York a week later. So we haven't seen the full impact of those yet, and they will start to show. So it'll be a challenge this week to see if there is some improvement numbers, which is accredited. The abating of the Thanksgiving weekend aspect, where we found the number of health units reported a lot of gatherings, not adhering to social distancing, sometimes students returning back home from universities where there had been some cases at the universities. So there was an ongoing relaxing of the social health measures, and we're seeing some impacts on that as we see not only the number of cases going up, we've seen some more people in long-term care facilities going into the facilities, as well as students showing up at schools with positivity in some staff. But in light of that, our long-term care team continues to keep the outbreaks under control as best as possible. Unfortunately, there still are deaths. And as we said, always this time of the lag between when the cases start going up and the hospitalizations and the ICU admissions going up, there's a delay of 2 or 3 weeks. Already we've seen a significant increase in the ICU admissions as well as the hospital admissions, not yet comparable to the first wave, but concerning because we're now going to see the impacts of the increased cases with the laxity of some of the public health measures by different groups in different parts of the province. And of course, most of the numbers tend to be in the 4 health units that we have put into our modified stage 2. So we're going to see 2 impacts this week to see what happens in that. It was reassuring that we came back down to 850. We'll have to see how that works because percent positivity is still quite high for this second wave. Not as high as we got in the first wave, But of course, we're doing, on the average, 4 times the amount of tests per day as we did in the first wave. So it's not quite the equal comparison in that. So we're still asking for the public health people to say, again, this high numbers was a message that we're not out of this. We're still in the heat of this one here. We still have to do our measures. We're now into the fall, into the later fall season. We've asked people to use extra precautions throughout the province around the activity of Halloween evening because we really want to protect our children, especially those ones that are in cohorts or going to the schools. Our schools are not closed at the moment. We'd like that to continue. We'd like to keep those cases that are showing up in the schools positive coming from the community to get that number down, and including those coming to child care centers. So we've got to work at both those, but that really depends on the community transmission. That depends on the adults, everybody doing what they need to do to keep their children protected, to make sure they maintain vigilance around the proper distancing, the illness, staying at home, getting checked when you need to get checked and tested that way, proper hand hygiene, and wearing masking even for your children when they're in those congregate settings, especially out in public, and of course when they go to the school system. So we still have to really focus on this because remember, we're trying to drive down this second wave. And as you can see, we're not the only ones. This is a global issue as everybody's facing this, and some are in a lot more difficult situations than we are in Ontario or in Canada, and they have their hands full of trying to deal with that and respond to that, whether it's in Europe and parts of Europe, in the U.S. and other parts of the world globally, as each one's trying to work at this new territory of a second wave, and what does it consist of? What do you have to do to bring it down and bring it back under control? So overall, we're in a watch and observe period right now, but certainly assertive action to make sure people are doing those measures. You've heard them many times. We can't emphasize them enough that you have to keep doing it, do it again, and make it part of your normal activity. Much like when we first introduced seatbelts, we felt this was more of a bother, but most of us just do it by nature right now. We put them on. And we understand why they work and that and all the methods that are in there. So the same thing, some of these things are become second nature, and you just do it out of routine because it is what you need to do in the new normal, at least and for the unforeseeable future, especially as we go into the late of the year and early new year, and as we wait to hear any news of any approved and safe COVID vaccine programs. So there's the updates on where we are coming out of the weekend and what we're looking forward to and watching and observing as we go into the week ahead. So with that, we'll hand over to the media for questions.
We'll go to the phone lines. Just a reminder, 1 question, 1 follow-up. Over to the first question, please.
As a reminder, for any questions, please press star 1. First question is from Rob Ferguson at the Toronto Star. Please go ahead.
Oh, hi, Doctor. Just checking to sort out some of this confusion regarding Halton region. We were led to believe that a decision was coming today, and then we had these letters from the mayors out there and the regional chair and a couple of MPPs. Did you ever recommend that Halton go into modified stage 2? And where do you stand on that right now? Where is Halton sitting right now?
So when we had looked at the health units, as you know, we did go first with Toronto, Ottawa, and Peel because their numbers were rapidly escalating over a number of weeks. And different metrics, whether it's positivity rates, case per 100,000, number of factors there were concerning, and in discussion with the local medical officers of health who felt very concerned and felt there's a need to reduce the number of, I would say, congregate settings is the general category we said, where people were sitting inside for prolonged periods of time where they couldn't wear a mask, such as when you're eating a meal or you're in an exercise activity and other ones like that. So we put those ones at that stage. We did notice that after a while that York region was also escalating rapidly, and even before we even considered other ones besides that, including Halton, we had discussions with York region, and they were concerned that very soon they would have to move into that kind of limitation. So when we came up to look at that next cadre, while York was clear it was going, in my mind, Halton was on the borderline edge there of not the same category as the other 4, and discussing with the local medical medical officer of health. She was also not convinced yet that that type of measure of the modified 2 may be some partial measures that they might be considering. And so we said, okay, let's wait and see. And to see how your data flows over the next week or two, because we want to bring that back to our public health measure table. So far we've made no recommendation to our minister and all up in the cabinet yet on what to deal with any changes with Halton or other health units besides the 4 we had already put in modified stage 2.
The Premier at his news conference today was saying that you're open to letters from people. So have you ever had letters like this, like you have from Halton, that were sent over the weekend? And how much would they influence you when you're looking at numbers versus concerns like that about the effect on business?
I have had letters from various municipal officials that have written, boards of health chairs with some concerns, sometimes wanting more action, sometimes less action, some issuing their concerns about a specific topic or an area they would like to have considered in that. I haven't had one from local members of parliament. I've had some from opposition members on that, so that was new for me to see that one. So that was unique. But I have had letters, and we take all those seriously. We put them into the table to look at, because sometimes there are areas that, not saying don't, but some say want us to do more, and we want to weigh that in and look at the data and information as we consider these are official local leaders and they have some commentary they want to make on it, and we take those ones seriously because they're elected officials and they understand their communities, and so we want to be aware of that as we look at that, because we're dealing with populations. And we work with our local medical officers of health because they make decisions on their own. They report to their local boards, which are municipally incorporated. So they may be independent boards with a municipal board, autonomous. They may be part of a regional structure, as in the 4 we noted, or Halton, or other ones like that, because the medical officer of health may be part of that regional or municipal structure. So they report in and through that one as well. So we have a variety of different governance models, but those medical officers and those boards are autonomous in that sense and make their decisions. So they don't take direction. I don't direct them. I consult with them and seek their advice and input as they would see fit on that matter, as I've done all along.
Next question.
Next question comes from Melissa Candelaria at Your TV Halton. Please go ahead.
Hi, Dr. Williams. Thanks. Just further to the Halton question, I was just wondering, because it was discussed, of course, so we know there's so many things to consider when deciding whether a region goes into stage 2, but also in this open letter it was indicated if there is going to be a more clear-cut criteria in which the government and yourself would decide whether a region goes into stage 2. And further to that, if there are guidelines in place as to what threshold governments will look at as to when they would get out of stage 2. So for those that are in stage 2 right now, is there something that you are looking for, a percentage, a meter in which that we can we can actually have as a guide to work with?
Okay, there's about 4 questions there. And that I'll try to remember and remind me if I missed some on their approach there. First of all, on the action around the decision making, there is a variety of metrics that we do use. One of the reasons why we use a variety of metrics is because how the pandemic is presented in each of our health units is not equally the same. How our health units are composed or comprised of different municipalities and structures is also not the same. Some are very dense urban, some are more of a mix of rural and urban, some are remote. And so what would affect their numbers has to be taken into consideration. So if you have one that has a large central one and a large rural one, they may say it only needs to impact this one or this area here, or maybe a specific issue that a medical officer of health may want to write a Section 22 order on in that one. So we're trying to be aware and sensitive of the milieu or the nuancing of each health unit and how that number is impacting the overall community spread in their respective jurisdictions. So if there was a clear-cut formula, it may apply in some cases, but I'm sure some would say that was that was not an appropriate application in our setting because our setting is different because of A, B, C, or D, and those would be relevant and important aspects if we listen to the input of the local medical officer of health and their interpretation of how it's impacting each of their respective communities and subsections within their health unit, which is a geographical area, as you may, which is comprised of various numbers of sizes of communities as well as rural areas as well. And of course, they are adjacent to other ones, and they are impacted by what their peers to their north, south, east, or west is having on them. So it is complicated if we're going to be flexible and adjustable and seeing the needs of the local area and being responsive in that way. That would affect us also as we roll up and then as we roll back down again, because it may abate in some areas and some areas quicker than other areas. So like already we're seeing Ottawa coming down a bit, but it hasn't come down massively and it still has some numbers still in there, but that's looking encouraging. I think that's more the actions that Ottawa has taken. Some of the ones before when we did the pre-modified 2, when we asked them to curtail some of the activities places and not close them. And so that may have some impact there as well as their local impact of their case contact management and other activities as well. So there's variations of when you give advice of how to move up, because one thing that it was always, as a local medical officer, if something worked in Toronto, it would not work in Northern Ontario. And it seemed inappropriate why we would have to be bound by what was conducive to a Toronto decision. And so as a local medical officer health, then I would say you have to look at my health unit in its uniqueness. And before you make decisions, I would like to be consulted on the matter, and that's what we do, and we ask them for their input on that. The same would be opening up and the numbers on the values therein as we see it happening. So that was 2. I think I missed one of your questions.
Follow
No,
up?
that was it.
Okay, thank you.
You covered it all.
Follow up?
Yes, actually, further to that, and I know right now you had said that there was no indication when you made when you were making the decision that there was no, guideline into putting into Halton into stage 2. Are we going to expect something like that later in the week, considering that it is closer, of course, to one of the biggest days of the year, which is Halloween? And I know a lot of people kind of depend on what they're going to do this weekend based on what stage their region is in. So are we going to learn more about where Halton may be at some point this week?
I would think if there's any recommendations that we are going to make, because remember, the Public Health Measure Table advises myself. I then advise the minister, who advises the premier and the cabinet. And because it's under the ROA, which is the follow-up of the Emergency Powers Act, MMPA, they would then make that decision. So it's on the advice. So we have to see what the advice and how the numbers, we're going to get some new numbers tomorrow to see how it's gone over the past week, because we're looking at trends, not one day by day, because we don't want to make decisions on just one bad day, because we'll see sometimes some smaller health units have an outbreak and all of a sudden they go up to very high numbers and then 2 days later they're back down again. So we will look at that. I think Halloween, what I've been encouraged by is that whether you're in the modified zone 2, and let's make clear, we call it a modified 2 because it's nowhere near the limitations of stage 2. There's only some things in the modified 2 that we put back in, namely those congregate settings where people can't wear a mask for a prolonged period of time indoors. There's a lot of things that we had in stage 2 that are still open now, schools being the case, and other ones. So it's a modified 2. And then, but some said, well, there's some things before you could do to just sort of gradually dim up, or brighten up the switch a bit on some issues, or down, as in like we did originally with Toronto, Peel, and Ottawa, where you said, well, maybe you should have just a little bit less people going to the restaurant, less people going into the exercise gyms rather than closing. And so we had that in place. Some are asking about those, and you've seen some local medical officers of health who felt concerned enough now that in their respective jurisdictions and under their authority, they put in Section 22s to do those things, such as in Dr. Mackey in London and Dr. Romiliotis in the Eastern Ontario Health Unit. So I would think on the Halloween one, I've seen lots of people putting in, even now, even the ones that are not in Modified Zone 2, are saying, we're not going to do the usual thing because we're concerned. And as parents of that, we're going to do a fun type activity with a parade, or they're going to do a thing where they do just certain visits around their neighborhood. They want to be sure who are they seeing, where they're going with, and they want to accompany their children, and they want to still have the fun of that one, because it's mostly for the younger children in that regard. And they're doing things with the schools. There's some in-school activities also, so they really want to maintain that cohort of the protection of their children, because school has been a very valuable one. And I would say from the announcement from the Deputy Minister mentioned today, with no schools being closed, is certainly a major achievement of the system at this time when a lot of people were doubtful that we would even be open by now. I think everybody's doing a great job, but we have to keep being vigilant, and that includes at Halloween. So whether you're in Mod 2 or not Modified 2, I think those same type of protection things are good ones to keep in mind.
Next question.
Next question comes from Sabrina Jonas at CBC Toronto. Please go ahead.
Hi, Dr. Williams. Just to switch gears a bit, I asked this question at the city level and was directed here. So when it comes to larger gatherings that are helping drive COVID numbers higher, why are wedding ceremonies still allowed to have 30% venue capacity in hotspots like Toronto? Receptions are capped at 10 people indoors and 25 outdoors, but a 30% capacity in a big Toronto church could push those capacity numbers well above the outdoor maximum.
Okay. The 30% at the religious ceremony in a church was one we had agreed on earlier on, with a number of ceremonies that have constitutionally have the ability to gather together for a religious ceremony or rite. And they can have, we said before, 30% of the capacity in their facility to allow for enough distancing. They have to wear a mask and still be socially distanced in that. There's limitations on singing, as well as some other activities that are in there. And we know that a number of the church and congregate groups are still trying to advocate for even more openness and leniency, but we have stated that number right there. So you can't confuse the religious ceremony with the follow-up reception party, which is a different thing altogether. And that is not allowed to be the 30% occupancy. That has to then go to the new rules of the 10 indoor, the 25 outdoor, with the masking, with the social distancing, because it's not a household. And so some people say, oh, they're going to have 10 indoor and everybody can just congregate if they want, or 25 outdoor and just go around and socialize and on the dance floor, whatever. That's not the case. And so we've seen some more outbreaks even during the Thanksgiving weekend related to weddings. And they have had widespread effects out to other parts beyond the health unit. So people should be adhering to those. And when we say 10 indoor and 25 outdoor, it's not 10 and 25, do whatever you want. That's not the case. It's with the public health measures being in place. Only ones you can be close with is still your family members in your household that we have said is the new rule to follow there. So I know some people find that confusing, but some I think are saying, I just don't want to follow it. And I say, that's a bad mistake. And we've seen some of that happen. And you don't want to put your family members and your extended family and your friends at risk by not being careful during this time, especially when there's high transmission in your area. You got to be very careful.
Follow-up?
Yeah, so if we're, it's because we're seeing cases climb here in Toronto, can we expect to see any, updated recommendations to these large gatherings? So I know you say, we can't confuse not wearing masks or socially distancing and stuff, but we do see that there is still an effect from these large gatherings. So can we see any updated recommendations here?
Well, we're trying to see the impact of the new modified 2s. It's a little bit early yet. The city can use its bylaws to enforce those. The Premier already notified earlier. If we go back to the 19th and 25th of September, we brought in the social rules throughout the whole province with the gathering numbers, the enforcement of those, and the fining of individuals who held events that didn't adhere to those. So that is still in place and still continues to be monitored and enforced. Local bylaw officers have that capacity, and in working with provincial peace officers can enhance that even more. And there's some aspects, of course, if you're violating that, you may be putting the staff of those institutions, if you're using, in some situations outside the modified 2, a banquet hall with a reduced numbers, you would be putting the staff at risk if you didn't functionally operate that way accordingly. So there is a health and safety issue related to the staff accordingly. So we want to make sure all those things are followed and adhered to. And that really still gets down to the people have to say, I know it's an event, I know it's a special time, but it's a special time to be careful as well, and to give it to your parents or grandparents that might be there, and if they had to get hospitalized, it would really take away from the value of the event. And so be careful, be consistent, and follow that. That's what we're asking to do, and we'll see what the impacts of that are. But the local health unit can monitor the situation with their bylaw officers and to ensure that those facilities in the modified 2 are being adhered to, as we have reduced the number of events, even at those banquet halls, down to even smaller numbers in the modified 2 as compared to the graduated reduction that we recently did in Toronto, Peel, and Ottawa.
Next question, and this will be the last question.
Last question comes from Brian Lilly at the Toronto Sun. Please go ahead.
Dr. Williams, when you've released data that you say is to back up increased restrictions, such as you did just before the October 9th announcement for the modified Stage 2, it wasn't specific to regions. It wasn't specific to industries. Mayor Watson in Ottawa has written a letter to the government asking for Ottawa-specific information, and my understanding is he hasn't received anything in the last week. This weekend, we had the mayors of a number of areas in Halton ask you and the Premier for region-specific and sector-specific information. Can we expect to see that, or does that information not exist?
Okay, about 3 parts of the question there. I think the first one is that I was trying to interpret when you said before we did the modified 2, we did something else. And to be clear, we did put in place in Toronto, Ottawa, and Peel, just in those areas, the increased restrictions on some activities related to those congregate settings, such as numbers in banquet halls, numbers in gymnasiums, and numbers in restaurants, indoor dining, and spacing, all those kinds of stuff. We did put those in for a short period of time, but their numbers escalated, and so in consultation with their medical officers of health, who said, because the widespread amount of community transmission, this package of almost 10 things in the modified 2 included a number of congregate indoor activities where masking wasn't capable, even though some said, well, it's more of an issue here. We've had evidence there and there. All those are risk factors, as our science table said, of increasing the rate of transmission, especially if your prevalence rate or your percent positivity is elevated. And so you put everybody at risk, even with a small gathering of 20 or 30 or 40, 50 people. So we put that out, and we did ask at that time the medical officers, does your municipal government side understand that and agree with that? And the answer was yes. I think then some had some concerns afterwards to say, well, in this one particular area, why was that? And but even then, sometimes after that, almost like the timing, they would have an outbreak in that event. So it's a dynamic changing things, and we understand that even when you just consult with the medical officers and you ask if they're regional, municipal, the government structure they're in, do they concur with it? They'll say, well, we're not happy with it, but we understand it, and we'll have to do what we have to do. And so they understand the implications of it, and no one's welcoming it, but the medical officer of health may say, because of the rising numbers, the difficulty of doing case contact management, to bring it under control, to reduce this kind of thing, that they say we need to put this in at this time. And we have that consultation, whereas some on their own have written Section 22s to do that. And we assume they've consulted with their Board of Health or with their municipal counterparts, so that I'm sure the mayors and council would say, we're not thrilled with this, but we understand it. And something we need to do to protect our community writ large. So there's that balance between some of these measures, which are slightly turned up the dial, but not fully turned the switch. And people sometimes misuse the term that some are in lockdown. No one's in lockdown. There's no one considered at this time being locked down in that. So I think it's a misuse of the term if you compare to what other countries are doing in their versions of lockdown. So we're turning the dial back up. Remember, we were turning the dial down all the way through stages 1, 2, and 3. We're opening things back up again, and now we have to turn it back down again. We'd rather not just turn it way back. We'd rather turn a bit at a time in different areas, and then see if we can then open it back up again when the numbers reduce and the transmission drops.
If I could just add, I know that oftentimes now we're getting questions from local politicians, show me which restaurants have an outbreak in my jurisdiction. I want to see. And the thing is, I'll give you an example. The big outbreak with Spinco in Hamilton. It began with someone who probably got infected at a bar in Toronto. So we don't see a bar in Toronto. That bar doesn't have an outbreak that we're aware of. However, it caused a huge outbreak in a gym. So we're looking at, the studies have shown that when you compare cases and controls, people who are a case have about a 3 times increased risk of having been eating in a restaurant in the previous 2 weeks. So a restaurant is one example of a place where, as Dr. Williams said, people are in close contact, they're not wearing a mask because they're eating. And that is the kind of situation where people can easily transmit this infection. So just asking where are the outbreaks and prove to me that it's in this particular type of place, what we're seeing is a lot of outbreaks, a lot of community transmission, and we're trying to look at the places where we know transmission is most easily happening.
And another part of your question you asked, I didn't answer your question, that those regional governments and their boards of health have access to the same data as we do. And they may have more access to more granular data than even we have at their local level. So I'm a little bit surprised to say, well, we didn't know about these numbers when they could ask their medical officer of health who could give them the numbers. So I think there's nothing in secrecy here. We depend on their numbers. It's their health units doing the reporting to us, and we trust their health units to do it in a timely fashion, do it accurately and correctly. And so that number is known to the local health units well before we know it, and the details and even more granularity, as you've heard sometimes from Toronto about percentages in certain parts of the city, we depend on them for that data to be given to us. So I would say that those officials do know the data, and they can look at it and get access to it if they consult with their local health department.
Follow-up, and this is the last question.
Well, it's interesting here you express a frustration at not having full access to data, because that's one of our frustrations, trying to report on this and trying to explain it to readers, viewers, listeners. And whether it's, asking, I never asked about a specific restaurant, maybe politicians did, but asking for sector-specific data on restaurants or gyms, that doesn't seem to be there. Asking for information on the ages or comorbidities of people in hospital, that's not there. Are they in hospital because they were in for something else and then tested positive for COVID? They don't have it. So do either of you feel that there is enough information that you have, or should there be more and deeper information available to both of you, but also the government and the public?
We have a committee and different ones that look at surveillance data, the use of it. We get as much data as we can. We know that, for example, if you're asking about those granular details of hospital, ICU admissions, etc., we have to be cognizant of stuff. If we're going to ask that kind of data from frontline staff who are busy looking after patients that have to sit down and fill out data sheets and everything, they're actually not too thrilled with doing all that. They will help as much as they can. That's a large workload added to their heavy workload already. So we have to be aware of what we may be asking and what we're going to do with that surveillance data. If we're not going to use it, we should not be asking unless it's appropriate and valuable to use at that time. I think when you get down to local, very local issues, you have to ask what's the value in that, because I think sometimes it's misconstrued as saying we're going to close down restaurants in this area because there's evidence that the restaurants in that area are the cause of it. As Dr. Yaffe just alluded to, there was a case where there was in Toronto, had not recorded in Toronto, but had a big impact in another health unit. We're saying it's not the in particular place. The public health measures was on congregate indoor settings, a variety of them where people sit for periods of time that find it impossible to wear a mask. And when we know from the science table on that, and ratified by the National Technical Group, that when you have a percent, like 50 people in a room, and you have a 1% positivity, which we're well above that, you have a 60% chance that someone in the room is positive. If you're talking about 2 or 3% we're at now, it goes up to 80 and 90%. So the fact that you're in there means you're probably going to get infected. That's why we're trying to discourage those type of activities. You can do your thing on your own outside. You can walk around with a mask on. You have your household with your 5, 6, 7, or 8 people that you live with all the time. But when you're in a restaurant, can you be sure? When you're in a gym class like the one with the SpinCo that Dr. Yaffe alluded to, you assume that maybe no one is, but people are incubating. You don't know. And what happened? You got transmission. You got a lot of cases. And so it's not because you're responding just because you found one here and one there and one there. It's the congregate activity that the public health measures said we need to stop that activity because the community transmission is occurring. We stopped also the backyard gatherings with the large numbers. We put that out on the 19th and the 25th of September. So we're doing whatever we can to lower down people from doing that. If people would just not do it, we would not need any of these rules. And that's what we've been asking for. We're asking now to really focus on that because it is really your responsibility for yourself, but more importantly, for the others in your group. And if you get it, when you're at time of incubation, you can give it to family members, including people who are predisposed, who could end up in the hospital quite ill, or unfortunately could die. That means elderly people and others. So it goes beyond just your thinking of the moment. You have to think beyond that. So we're asking that, and we're putting in place our measures as best to give that clear messaging that in these areas where we have large transmission, and Dr. DeVille has noted some parts of their city have very high transmission rates and positivity rates, and we're trying to deal with those in those type of congregate population-based approaches, not going, if there's institutions that we're totally violating, that's for the enforcement side to deal with, and we're dealing with that. That's a one-off, and that's disappointing when it does happen, but you have to go after that. So we are going after that. At the same time, we're reducing the population risk, especially in those areas of high transmission, but we haven't put that on the rest of Ontario. We haven't put a lot of restrictions on Northern Ontario. The rates are still very low, and so we have to be appropriate in different parts of the province.
So if I'll answer as well. You asked about are we satisfied with the data that we're getting? Is it enough? I can tell you we get a lot of data, and sometimes you get overwhelmed with data. We have to make sure that the effort put into gathering the data and reporting on the data is a valuable thing. And so we certainly get a lot of data around the burden of illness, severity indicators, hospitalizations, ICU and deaths. And we can break down the deaths, of course, into ages and whether they have underlying illnesses. We also get data on public health system capacity, the number of contacts per case, contact follow-up, and so on, and the healthcare system capacity. One of the things we're hoping to do is the province to do a survey around human behavior, because really it does come down to human behavior, right? Like each and every one of us has to make sure that we do the things we know we should do to prevent transmission of infection. And are we doing them? And of course, then we also get the data on the testing. So there's a lot of data. There's a lot of good information, and we're continuing to monitor and see whether are we getting the right information and should we modify it.
Thanks, everyone.
Thank you.